Hernia refers to symptoms in which organs in the body are out of place and protrude or stuck out through other tissues. There are two types of hernias, one of which is external and the other is internal, and inguinal hernia accounts for 80% of external inguinal hernias. This can be caused by the diverse causes, including chronic cough, strenuous exercise, muscular weakening, and obesity. Inguinal hernia is further subdivided into indirect inguinal hernia and direct inguinal hernia. The indirect inguinal hernia travels along the same path as the spermatic cord and come to the inguinal canal starting from the deep inguinal ring. Indirect inguinal hernia occurs on the lateral side of the inferior epigastric vessel and enters the scrotum. Direct inguinal hernia come to behind the superficial inguinal ring by penetrating the weakened region of the abdominal wall. It occurs on the medial side of the inferior epigastric vessel. Sometimes, while watching without surgery, the intestine comes down into the hernial sac, and this can lead to the incarceration state, which does not enter the abdominal cavity again. In severe cases, it progresses strangulation state, which is a condition in which does not flow. In this case, if the intestine is not returned to the abdominal cavity very quickly, intestinal necrosis occurs. Operation is performed after carrying out the intubation and general anesthesia. After anesthesia, an incision of about 1 centimeter is made in the umbilical region. The carbon dioxide is injected through a trocar, and the pressure of carbon dioxide is used to secure the extraperitoneal space. At this time, if the extraperitoneal space is narrow and difficult to approach, intra-abdominal approach is performed at the discretion of the operator. The endoscopy camera is injected into the extraperitoneal space through a trocar, and then make 2 more holes to insert the laparoscopic instrument. The operator performs the operation while looking at the camera image projected on the monitor. By separating the hernia sac surrounding structures, restore it into the abdominal cavity or cut the proximal region and ligate it. In the case of adults, the operation should be completed after reinforcing the surrounding muscles and abdominal wall using artificial fascia.